Good morning, all. I'm Shaluni Tissera. I'm the International Medical Informatics Association Nursing Informatics Special Interest Group country representative. I'm working with International Institute of Health Sciences, IIHS Sri Lanka. I understand we are short of time, so I'll quickly go through my research. The topic is self-reported e-health literacy among undergraduate nursing students in selected districts of Sri Lanka. The contents are these. So for the benefit of the audience today, the concept, I would like to introduce the concept of e-health literacy and define what it is. So e-health literacy is the ability to seek, find, understand, and appraise health information from electronic sources and apply the knowledge you gain from these electronic sources to address and solve health problems. We have so many electronic health tools, as Dr. Uma explained. May it be an electronic health record, electronic medical record, or a software system, or a eHealth application. But these tools provide a little value if the intended user, mostly the nurse, lacks the skills to efficiently engage in these. The e-health literacy is comprised of 6 core skills or literacies, as I say. Traditional literacy, health literacy, information literacy, scientific literacy, media literacy, and computer literacy. Therefore, if a nurse, as we all are competent in e-health literacy, then we can be the people who run the hospital. So why a nurse should be literate in e-health is due to 2 reasons. It should be for us as for the nurse, and it should be for the patient that we are looking after. So for the nurse, we should get updated. We have to update ourselves, and we have to acquire new knowledge. And we have to practice evidence-based, so we need research activities, and also we have to be in par with the international standards, so we can't be left behind. And as for the patient, as you are a nurse, you need to educate them. You have to recommend certain things for the patient, and also you have to provide information. So if I talk about Sri Lanka, the Minister of Health Sri Lanka is leading several initiatives to digitalize the national health system. I don't know whether you are aware, as Dr. Nishan explained previously, Sri Lanka will automate the whole 300 hospitals by 2019. Therefore, this digitalizing the hospitals include familiarizing the public with the electronic health information sources along with you, the healthcare worker. However, the current levels of e-health literacy among nurses, who are the largest category of professional health care workers in Sri Lanka, is unknown. So the objectives of this research were to identify the self-reported e-health literacy level among third-year nursing students, and to assess the relationship of e-health literacy with their IT practices. So the method of the research was a descriptive cross-sectional quantitative study, which included 436 students, nursing students, and this was done using convenient sampling, and this population was selected from 3 different districts, Mathura, Ampara, and Kandy, which was done in 2016 with third-year nursing students. The data collection was done using a self-administered questionnaire. We used this special e-health literacy scale, we call it eHealth, to assess the knowledge of the students. So if I talk a little about this eHealth literacy scale, eHealth, it was designed to assess the consumer's perceived skills at using information technology for health. The consumer is you, the nurse, and also to aid in determining the fit between e-health programs and the nurse. So moving on to the results, majority of 64.7 of the respondents used a mobile phone or a tab in their day-to-day activities. And if when I ask about their internet use, they said they would spend, majority said they would spend 2 hours or more than 2 hours in their spending time in the internet. So this is basically what the eHealth is. So it comprises of 8 descriptive questions or as statements. The respondent is supposed to rate their level of agreement on these statements. So there are 8 statements. What health resources available, where to find helpful health resources, how to find helpful health resources on the internet, how to use the internet to answer your questions about health, your own questions, how to use the health information that you find on the internet to help you, and whether you have the skills needed to evaluate health resources you find in the internet, and whether you can tell high quality health resources from low quality health resources from the internet, and also whether you are confident in using information from the internet to make health decisions. Mind you, this is a self-reported question, self-reported e-health literacy among nurses. So the most nurses agreed, or they strongly agreed about all these statements or the questions. So how I analyzed this was I gave a score for each statement with the 5 answers that they could give. So a person would get a minimum of 8 or to maximum of 40 marks. So in this population, the mean eHealth score was 30.8 with a standard deviation of 3.479. The highest mean score was for knowing whether to find helpful health information, whether they knew. So a majority of 3.96 out of 5 were the mean score, and the least were from whether they are able to discriminate between high and low quality sources. So the score was 3.63 out of 5, which was the least mean score among the eHealth score. And the mean eHealth score does not depend on the duration of the internet that they used for their day-to-day activities. So apart from all that, I also analyzed the activities that they are performing online with these given times. So I found the majority of 55.9% of nurses use their internet or the time on internet just for the social media purposes. And also since this is a self-reported way of their health literacy, they said they are aware of using they knew that the internet is useful or very useful in using for decision making. Also, they said that they are aware that they have the ability to access health resources in internet as very useful or useful. So this is kind of it's kind of questionable whether, as this is a self-reported way of giving out their answers. But with the other questions that I put, we have come to a conclusion. The nursing students spend a significant time online on social media. eHealth literacy in terms of searching information was satisfactory. However, the ability to select or filter good quality information sources seemed to be less. The participants also spent a significant time online. Therefore, the time they spend online would probably be for socializing activities and for networking, that for core academic or information seeking activities. So we would like to recommend the nursing students should be given some kind of a formal training on literature search, information sources, search engines, and validation of information. That's what we are doing from IMIA in a special interest group as the country representative. And also they should be also told of good information sources that that they could use to recommend for the patients. And these are my references. Thank you so much.